Yeah, well, the most wonderful time of the year is almost here, but with it could come an uptick of sicknesses.
I noticed a few extra parking spaces outside today, which usually tells you something. NBC Connecticut's Melissa Cooney joins us live about the impact gathering for the holidays and the cold weather could have on us. Melissa?
Yeah, guys, I mean, we are ready for flu season as every year. Now, the State Department of Public Health announced Connecticut's first flu death of the 2025-26 illness season, a man in his 80s. This flu season, the state reports 541 cases so far. They say flu is relatively low this year. Now, also in the headlines, there's a new mutation of flu this year that caused a robust flu season in the southern hemisphere. That's informing doctors that our flu season could be rough, too.
H3N2 is probably going to be the predominant virus, which tends to produce some more illnesses. It may last a little bit longer. Now, just because there are mutations, it doesn't mean that you shouldn't get a vaccination.
Speaking of vaccinations, over 945,000 people in Connecticut have gotten their flu shot this season. The State Department of Health shows that's down from this time last year.
We still want to get those vaccination rates up. I think when we last calculated, it was about 26.1% of the Connecticut population was vaccinated. Previous years, it's been as high as 75%. And that's important from a herd immunity.
Wu from Hartford Healthcare says flu, COVID, and RSV are all making appearances in the hospital, but warns it may get worse as it gets colder and from holiday gatherings. DPH says COVID is the most active, but has leveled after a spike earlier this fall. There have been 7 COVID-19 related deaths this fall season. Additionally, Dr. Wu says they're seeing a lot of patients with rhinovirus, which is just a common cold, but it can be severe if you're immunocompromised or if you have underlying conditions.
We do focus on surge planning, and we do know that what we need to do is we need to get people either out of the hospital or into the beds rather than waiting in the emergency room or in the hallways or whatever it may be. Influenza and COVID, we can catch it early and we can treat them. And if we can get them out of the hospital, that would be even better, because if you're going to be sick, we'd rather have you sick at home as long as you're stable.
And of course, in addition to getting vaccines for sicknesses like the flu, COVID, and RSV, if you qualify, you can also try to give the people the gift of health this holiday season by cleaning your hands and staying home if you're sick. We know this, though, guys. For now, we're live in the studio.
Yes, Melissa Cooney. I think my mom, I can still hear her. Wash your hands, Kevin.
Still to this day.
Thanks,
yes.
Melissa.